Okay. So talking about neuro, an infant is born with all their nerve cells that they will have throughout their life. A maturation of these cells continue until the age of 4. Interesting fact. So we're going to kind of divide these up into acute and chronic disorders. Acute neurological disorders, we're going to talk about meningitis, encephalitis, and Reye's syndrome. Meningitis, we're going to viral and bacterial. Meningitis is the inflammation of the meninges, which meninges are membranes that protect the brain and the spinal cord. Viral, it usually requires only supportive care until recovery. Bacterial is contagious, and prognosis depends on how quickly the care is initiated. Risk factors of bacterial meningitis are skull fractures, or any injuries that provide direct access to the cerebral spinal fluid. Immunocompromised individuals, crowded living conditions. Bacterial meningitis has decreased in all age groups except infants less than 2 months because of vaccines. Your findings, your assessment findings are going to be different depending upon the age groups. For the newborn, you're going to see bulging fontanelles, but that's a late sign, and that's from the increased intracranial pressure. So you should see the fontanelles being flat, soft and flat. If they're sunken in, that means what? Dehydration. And if they're bulging, that means increased intracranial pressure. Bacterial meningitis is hard to diagnose early in newborns, just because they're very subtle signs. 3 months to 2 years, they may have seizures with high-pitched cry, fever, bulging fontanelles, nuchal rigidity, poor feeding, vomiting. 2 years old to adolescence, they may have seizures, and sometimes, a lot of times, seizures is often the initial sign. Fever, headache, rash, joint involvement, drainage from the ear, and photophobia. And this is important. Any child with a high temperature who then has a seizure should be assumed to have bacterial meningitis until the CSF is ruled out. So until they pull that CSF from a spinal tap and rule out bacterial meningitis, it should be assumed that they have it. So diagnosis is done from a CSF analysis. If it's bacterial meningitis, the CSF will be cloudy with an increased WBC count, increased protein, decreased glucose, and a positive Grimm stain. If it's viral, it'll be clear, slightly increased WBC, normal or slightly elevated protein, normal glucose, and negative Grimm stain. Blood cultures can be positive when the CSF cultures are negative. For a lumbar puncture, have the child empty their bladder, apply the Emla cream, which is the cream that numbs the area, 45 minutes to 1 hour before. Have them lie on their side. Sedate them with Versed or Sublamaze. Instruct the client to remain in bed for 4 to 8 hours in a flat position afterwards to prevent leaking and to prevent a spinal headache. And this is hard for children to do, because it's hard for them to stay still. Treatment, antibiotics, unless it's viral. We don't give antibiotics for viral. Corticosteroids, osmotic diuretics. Droplet precautions for 24 hours after the start of antibiotic therapy. And then antibiotics for family that's been in close contact with children with bacterial meningitis.
So viral has no treatment, right? It's
Yep, just supportive until it clears. This is just a picture of the swelling of the meninges. The top one is normal, and then the bottom circled one is swollen. Encephalitis is inflammation of brain tissue and possibly meninges. To prevent, children should receive immunizations against childhood diseases and use mosquito repellents. So West Nile is a common cause. Signs and symptoms can be headache, high temperature, ataxia. Do you all know what that is? Loss of muscle movements. Muscle weakness, diplopia, confusion, irritability. It can result in learning disabilities. Diagnosis can be made from history. CSF, you'll see elevated leukocyte and elevated protein. Treatment is supportive, antipyretics, antiviral, anticonvulsant, steroids, and osmotic diuretics. You've all heard of the next one. Rye syndrome. Think liver and brain. Acute encephalopathy with accompanying fatty infiltration of the liver, heart, lungs, pancreas, and skeletal muscle. Most commonly thought to be caused by giving children aspirin. So they say the cause is unknown, but it has been linked to aspirin. Increased incidence is seen in January, February, and March. That's flu season. Prognosis is best with early recognition and treatment. Assessment, so the patient will report a recent virus or use of aspirin during an illness. They'll report being lethargic, irritable, confused, decrease or loss of consciousness, and vomiting. That liver looks like a really good piece of steak. Probably should add lunch. The little smokies right now, please. Diagnosis is done by liver enzymes. You'll see them elevated. That's your ALT and your AST. Liver biopsy, CSF analysis to rule out meningitis. You'll see elevated serum ammonia level. Coagulation times will be extended. I think your aspirin thins your blood, so it will cause them to be prolonged. Liver biopsy. Lumbar puncture for CSF analysis to rule out meningitis. Nursing care, maintain hydration, monitor coagulation, assess pain, avoid extreme flexion, extension, rotation of head because it can be painful, maintain head in midline neutral position, keep head of bed elevated 30 degrees, and keep on seizure precautions. Yes? I don't know. For Rye syndrome? Has anybody else heard that?
What? I didn't hear what you said.
not give ibuprofen with chickenpox. She wanted to know if it was linked to the Rye syndrome or if it was something else. No, I can't answer that. Nice little research project. I don't know. Medications, mannitol helps with the cerebral swelling, and vitamin K will help with the bleeding. Seizures. There's different types of seizures. Generalized. We'll talk about the tonic-clonic, which is formerly they refer to as the grand mal seizures, the partial, and the idiopathic, which is the unknown cause. Idiopathic account for 50% of seizures, so 50% we don't know the cause of them. Seizures are sudden, abnormal, uncontrolled electrical activity in neurons of the brain. Risk factors: head trauma, genetic, abrupt cessation of medications. What do you think in children? What do you think of risk factors?
Fever.
Fever, yeah. Diagnosis by EEG. Teach them no caffeine for 6 to 9 hours prior to, wash their hair. Make sure the parents know to bring their children in tired for the test. So education or nursing care for children with seizures. Protect them from injury. Put them in a sideline position. Loosen restrictive clothing. No restraining the patient, and do not place anything in their mouth. Probably heard this multiple times, even with your adult patients. It's the same. Post-seizure, sideline, take their vital signs, do an assessment, neuro checks, provide rest, provide support, document the onset, the duration, and the level of consciousness of your patient. For febrile seizures, they're associated with high fever, 102 to 104 degrees. Prevention is key by keeping the fever below 101 with the use of Tylenol, ibuprofen, and cool washcloths. Teach parents that every febrile seizure needs evaluated to rule out what? What did we just talk about? Meningitis. Caution not to give PO medication in post-ictal period due to risk of aspiration. Not sure where this takes us, but we'll see.
A seizure is a brief episode of abnormal electrical activity in a person's brain. It's like when your radio goes fuzzy when you go through a tunnel, or when your television gets funny pictures for a couple of seconds and then turns back to normal.
There are many types of seizures.
With some seizures, a person may become very stiff. They pass out and their whole body shakes.
Some people have seizures where they become confused and may have movements that seem silly or don't make sense. They might not respond for a couple of minutes.
Some people have seizures that are so short that all they do is stare for about 10 seconds and may just flutter their eyes.
Some people have seizures where very suddenly they become weak and fall to the ground.
Some people have seizures daily, others have them every couple of months, and many kids have them every now and then, or never because they're on medications to control them.
Epilepsy is when a person has 2 or more seizures from something other than a head injury or from being very sick. Having epilepsy or seizures is nobody's fault.
Sometimes people may have different types of seizures with their epilepsy.
Some people with epilepsy may have a reason for their seizures, such as a brain injury when they were born or a trauma that may have occurred.
But for most kids with epilepsy, we don't know the cause and we assume it was something they were born with. There are a lot of medical tests for someone who has a seizure or seizure disorder. These tests are important because they help your caregivers keep your body safe and healthy. One of the most common tests is called an EEG. This measures the electrical wave patterns in our brains.
What do you mean we have electricity in our heads?
Everyone has a pattern of electrical activity in their brains to tell their bodies what to do. An EEG involves meeting one of the nice technicians who will put little wires called leads on and around your head. While the technician places the leads, you will lie down on a comfortable bed and watch your favorite movie for about a half an hour. During this time, the technician will measure your head and place each lead on one by one. For longer EEGs, they may need to use strong-smelling glue to make sure it really sticks and won't fall off. After they place the leads, they will then wrap your head in light, soft gauze. Now you have a silly hat. Later, we'll ask you to blow on a pinwheel for 3 minutes to see how fast you can get it to spin. It's best if you can fall asleep for a little bit, so bring your favorite stuffed animal, a blanket, or book to help you fall asleep. The last step is a flashing light show. All you have to do is sit back and enjoy. After all of this, your caregiver will remove the gauze, and the technicians will use some cold, wet liquid to remove the leads. This won't hurt either. And then, except for some funky hair, you get to leave.
All right. So, status epilepticus is a prolonged seizure greater than 30 minutes. The main thing during a seizure is you want to maintain an airway, administer O2, establish an IV, perform an EEG, pulse oximetry, ABG results, administer loading dose of Valium or Ativan. Main thing is airway, obviously, ABCs. This is actually kind of a corny video, but if you're thinking like of test questions, it's easy to think back to the video because it's so corny.
Billy's having a seizure. He needs help. We need to stay calm. We need to turn him on his side. Here, I'll hold on to his legs. No, can't stop. Stop. Wait, use something. Here, use this.
see how long his seizures last. If a seizure lasts more than 5 minutes or he has 2 in a row, we need to call 911.
Here, put this in his mouth.
No, never put anything in someone's mouth that's having a seizure.
I think it's over. It's okay. You just had a seizure. I know you're feeling tired right now. Let's just rest and wait till you're ready to go home. Epilepsy. Would you know what to do? Don't forget, even though I have seizures, I am still me.
I warned you. Alright. Alright, so head injury, I was scanning through here while that video was going on. Nothing too specific to children. As far as the positioning, the decorticate and the decerebrate is the same as you see with adults. As far as history taking, ask how did the head injury happen? Are they experiencing any dizziness, headache, vomiting, memory loss? Are they under the influence of anything? Assess their level of consciousness, orientation, vomiting, pallor, vital signs. These are notes on here, and it's the same as adults, so I'm going to skip over that head injury part of it. Glasgow's coma scale is the same as you see in your adults. Increased intracranial pressure, this is kind of generalized for all your neuro patients, so think about things that may increase intracranial pressure, and think about things you can do to reduce that. So what are some interventions and risks could do to decrease intracranial pressure? Okay, so positioning. What else? So keep head to bed elevated, at least 30 degrees. What else?
Dim the light.
Dim the lights. I don't know if that'll actually decrease. Calm environment. Okay, it would. Yeah. What else?
Avoid coughing.
Avoid talking?
Coughing.
Coughing, yeah, coughing.
Stool softener.
Stool softener, yeah, get those hard turds in there and it really increases that. Yep.
Prevent vomiting.
Prevent vomiting, very good. Avoid extreme flexion or extension or rotation of the head. So anytime they're turning the head or doing any of that stuff. Maintain neutral position of the head. Avoid moving the hips or the legs or any straining and moving of the body. Minimize suctioning, so endotracheal suctioning or oral suctioning. Avoid blowing the nose. We talked about stool softeners. This picture is the things, signs of increased intracranial pressure. So the infants, the bulging fontanelles, the cranial suture separation, increased head circumference, and a high-pitched cry. And the other ones are your children. When asking health history questions about the child admitted with Rye syndrome, which would be considered a common finding?
Recent flu.
Courtney says D, recent influenza illness. Everybody agree? So sometimes parents will administer aspirin during flu season. recent influenza illness. A 12-year-old experiences absent seizures. Which of the following is atypical manifestation of this type of seizure? We didn't really go into the different types. Rapid blinking 10 seconds. Which of the following is a priority intervention a nurse should take when caring for a child who just experienced a generalized seizure? So these were like the grand mal type seizures. Keep the child in a sideline position, take the child's vital signs, reorientate the child by calling his name, check the child for injuries. Okay? Stop. Keep the child in a sideline position. So the greatest risk is aspiration, so we're worried about airway. Like I said, this should be illegal after Thanksgiving. All right. Feel free to go.
They're going to be wasting the newspaper forever.
I know I want a car. Like I don't want an SUV or anything. Because we were talking, you didn't dress him up. Oh yeah. Yeah. Like two dresses.
Well, I don't know if it will yet. But I have some people have normal schedules every Friday, Saturday, Sunday.
No, she did. Yeah. Standing in the corner. Yeah. Standing at the house. What did you say? they're small classes up there, so.
Yeah.
St. Johnson Elementary.
No.
But she's very well.
Yeah, they'll like that.
Yeah, my aunt's a first grade teacher there. She's like, you guys are definitely doing my class. I'm like, that's getting a little selfish there. She's like, I don't care.
Yeah.
Also, so yesterday, she showed me a little part right now. She gets Trenton. Yeah, I'm acting right now. Yeah, he's got his Zoom or Dino.
What I tell you, 40
That was a long time, which really, I mean, I've already had to chase it and practice. Yeah, she was going to sit up and be in the I always like to take them before this is supposed to be. Yeah, and it locks me out. This is, I
think it's like a 9
something else. See, yeah, it is. And you're buying stuff. Right. Because I tell you in October, it's going to be available on December 21st.
That's what they just said. I didn't either.
Well, I know, it's outside. Oh yeah, it's well down for today.
You want a cupcake? Just trying to make sure it's all here. I'll see it Friday. Yeah, I'll take it Friday. I want to go ahead and take it so I can be able to take it. Mandy, you want a cupcake? Thank you, though. I've been so good, so I was so bad. And I'm doing Thanksgiving.
At 7:30.